Hi there, I'm Claire, and I'm going to explain my PhD research in just 3 minutes. I'm researching relationships and sex education in schools, known as RSE for short. Specifically, I'm trying to find out how many parents remove their children from RSE classes and understand the reasons why they might do this. So why is this an important public health issue? Well, relationships and sex education is about a whole lot more than putting condoms on bananas. Good quality RSE enables young people to develop the knowledge, the attitudes, and the skills that they need to build healthy, safe relationships and have better sexual health. And there's good evidence that RSE works in delaying young people's first experience of sex, increasing the use of condoms and contraception, and reducing unplanned pregnancies. Studies also show that RSE can lead to protective behaviours against sexual abuse and change attitudes towards domestic violence. RSE has an important role in tackling inequality, for example, in improving health and well-being outcomes for people that identify as LGBT. But over previous years, there have been criticisms that in English schools, RSE is out of date, of poor quality, and not universally available. But new legislation has been passed in England. Since September 2020, all primary and secondary schools must provide relationships education, and all secondary schools must provide sex education. Schools must follow the updated guidance, including that lessons must be LGBT inclusive. Parents can withdraw their child from the sex education part of the curriculum, and only up until 3 terms before the child's 16th birthday, because at this point, the young person can opt in if they wish. And this is where my research project comes in. My aim is to understand how many parents use this right to withdraw, and how many children opt in, and then what the reasons for doing this are. To achieve this, my project is in 3 parts. Firstly, a systematic review. I'm currently reviewing the literature, gathering all the evidence already recorded of surveys and interviews with parents about their opinions of RSE in schools, and this tells us what's already known. Next, I'm going to perform a survey of schools to count the number of children withdrawn from sex education lessons. I'm going to collect information to determine the withdrawal rates and see whether they're associated with any characteristics of the school or the student population. And finally, I'm going to interview parents who have decided to withdraw their child from sex education to understand their views. I'll speak to young people who've been withdrawn and those who've decided to opt in themselves. I'll also interview teachers about their experience. In developing an understanding of how many children are withdrawn from these lessons and the personal and contextual reasons for this, my PhD can form a vital part of the evaluation of curriculum reforms. The results of my project can inform plans to increase the uptake of the curriculum, with the overall aim of improving health outcomes for children and young people. Thank you for watching.